Hello, how are you? My name is Brianna. I'm going to be the advanced care provider today that's going to be doing your assessment. Hi,
Hi,
nice
my
to
name is
meet you.
Shannon.
Shannon, hi, nice to meet you. Is there anything bothering you today? Any pain, discomfort, any shortness of breath anywhere?
No, ma'am.
No, okay. Do you have any health problems that you know of?
No, ma'am.
Any allergies?
No, ma'am.
Any family medical problems? Mom, dad, parents, siblings?
The most I know about is diabetes.
Who has diabetes in your
My
family?
father's side.
Your father, does your dad have it?
Mm-hmm.
Okay. All right. If his is controlled or have any idea?
No, ma'am.
No. Okay. Have you ever had any surgeries?
No, ma'am.
Are you allergic to any medicines? Take any medicines daily? Do you know if you're up to date on all your immunizations?
Yes.
Did you have a flu shot this year, this season since September?
No.
No. Okay. Would you be interested in possibly getting a flu shot to prevent the flu? Okay. All right. So we're looking to getting that done. And you say nothing's bothering you, so I'll go ahead on and begin on your head to toe. All right, Miss White, I'm actually going to go ahead and get a set of vitals on you. Okay. Can you tell me how tall you are?
5'4",
5'4". Okay. I'll write that down. And about how much do you weigh?
I'm just 78.
178 pounds?
Mm-hmm.
Okay. All right, I'm going to get a set of vitals on you. I'm going to get some respirations, going to get a blood pressure and a pulse. Check the respirations, you can just breathe normally. All right, I got 16 there. May I see your arm? Okay. And you can just relax. All right, I'm getting 110/60. And monitor your pulse. So I'll just feel here. I'm checking your radial pulse. Right, I'm getting 74. And check it. I'm going to first begin off with doing the head. So I'm going to palpate your scalp, just feeling around, feeling if they have any lesions or anything abnormal. Is there any pain or any tenderness with me pressing? No, okay. All right, I'm also going to go ahead and inspect your skin while we're getting started. I am going to look around looking for any lesions, anything abnormal, checking the moisture, the turgor of your skin, and everything looks okay. I don't see any bumps or bruises. I'm also going to pull up your pants leg here so I can kind of get a good look at your legs and your feet. Don't see any bruises or anything like that. You're not ashen. All right. So moving on, I'm going to go ahead on and first start off with your eyes, okay? So I am going to utilize this pen light. I'm going to have you look straight ahead. And while you're looking straight ahead, I'm going to take this light and just come over from the side on both sides, okay? And that's going to be checking for pupil constriction as well as reactivity. So look straight ahead. I'll start over here. Right, and I'm going to check the opposite side. All right, and so she is having reactivity. I'm not going to check for constriction. Okay, and she's having 2+. So check those cranial nerves. Next, I am going to go ahead on and check her visual acuity. Can you see what this says?
Mm-hmm. Get well, Santa.
Get well, Santa. So that's what it says. So she is seeing okay. Gonna go ahead on and check her cardinal area, seeing if she can follow the light. So if you can just follow this light in each direction, okay, just with your eyes. All right, good job. I'm then gonna go ahead and move on to your nose. Any pain with me palpating here? No. Okay, and just kind of gonna look in there, make sure and we don't see anything. Mucous membranes intact. All right. Gonna take my depressor. And next I'm gonna move on to your mouth. Okay, so lips look okay, nothing going on. Can you smile for me? Okay, can you make a sad face? Sour face? Can you stick your tongue out? And puff your cheeks. So all cranial nerves there, as far as her mouth, are also intact. All right, so can you open up for me? Ah. All right, so shining my light. Stick your tongue out. Ah. Okay. Uvula, 9 and 10 cranial nerves intact. All right, checking out her teeth. Everything seems to be intact. Also gonna go ahead and check out her gums, which also it seems to be intact. I don't see anything abnormal going on here. So I will move on. I'm gonna go ahead and palpate around her ears. So over here, auricle intact, no abnormalities, any tenderness here, any pain. Okay, so just feeling around. I'm gonna do the opposite here. And then we're gonna go ahead and do the whisper test. So I'm gonna tell you a number and you can just tell me what I said, okay?
31.
Good job.
15.
15. So hearing is definitely intact. Gonna go ahead on and move on to the neck. So I'm first gonna start off with palpating your lymph nodes. I'm gonna do preocular here. Any pain? And then post. Right, gonna do occipital. And then I'm gonna feel down. Neck. Making sure trachea is midline, which it is. Also palpating here, the thyroid. Gonna go ahead and check, making sure she does not have any swelling, any distension in her jugular vein, which she does not. Can you say ah? Open up, just feeling her TMJ, which feels like it is intact. No abnormalities. We're gonna check your range of motion of your neck. So can you just kind of move your neck here to the side, back, front? No pain or discomfort with that? Okay, all right. Next, I'm gonna go ahead on and I'll go ahead and do your abdomen and your lungs. But first, we're gonna actually do your lungs. So I'm first gonna listen. Deep breath, honey. And again. Again. And one last time. All right. And so definitely symmetry there. Can you turn a little bit for me? And can you say 99?
99.
Okay. So definitely tactile primitive. Also 99 again.
99.
All right. Deep breath. All right. So symmetry noted. I'm going to go ahead and listen anterior. Deep breath. Again. Deep breath. And one last time. All right. Everything sounding good. All right, Miss White, I'm going to go ahead and listen to your heart, okay, honey? You can just relax. And just listen to our hearts, different areas. Checking the apical as well. I'm getting 68. I'm going to go ahead on and have you lie down for me. If you want, you can put your head possibly this way so that way we can catch everything for you. So I will want to let you know I'm going to have to lift your shirt, okay? All right, so looking at your belly. First, we're starting off here with inspection. Stomach look okay as far as contour. Moisture, I don't see any lesions, any bumps, any bulges, any abnormalities. I am going to also go ahead and check the umbilicus, which does look like it's intact. Next, going to move on with auscultation. I'll go ahead and listen to all 4 quads, seeing if I hear vowel sounds. Start over here. Bowel sounds definitely present. I'm going to see if I can palpate the liver, spleen. All right, take a deep breath for me. All right, and see if I can palpate the spleen over here. And then when I'm palpating, I'm also going to go ahead and catch the different quads. Right. Any pain or tenderness with me pressing? Okay. None? None? All right, and just kind of going back over here to go a little deeper. Feel okay? And then while I'm down here, I'm also going to go ahead on and palpate the kidneys. See if I can feel the kidneys. And I do not. I'm going to go ahead and percuss. Definitely can feel the difference in the sounds over those different organs, specifically over the liver, compared to some of the other hollow areas. All right, while she's laying down, I'm going to go ahead and palpate for a femoral pulse. So just going to feel right here, okay? Feeling for your pulse. You have a pulse in this area. Okay, so pulse is normal. All right, while she's lying down, I'm also going to go ahead and palpate her popliteal pulse. You can just relax, yeah. You don't have to move. All right, her dorsalis pedis. And then her posterior. And all are 2+. No abnormalities. I'm also going to look at her feet while she's lying down, making sure everything's okay. I'll go ahead and test her reflexes also while she's lying. So I'm just going to touch it with something and you can tell me if it's dull or sharp, okay? Also checking her face. All right. All right, and then her Babinski while she's lying down. Okay, so it's definitely giving her the expected sensation. Okay, so next I'm going to have you sit up for me. I'm going to check your other reflexes, and then after that we're going to have you walk, okay? So I'll start off with bicep. I'm going to do bicep and tricep. All right, so just relax this arm for me. All right, let me check up here. All right, and I'll try your Achilles. You can just, yeah, just let your leg hang. Don't lock it up or anything. Okay, good reflex. All right, so as expected, I am going to have you stand up for me. Okay, so now we're moving on to neuro. Can you bend over and touch your toes? Any pain or discomfort with that? All right, we're going to check your range of motion of your spine. Can you lean to the side? Okay, opposite side, back, front. Any discomfort with any of that? Okay, I want to check your cerebral function. So I'm going to have you take your foot and put it up. Yep, to your shin. Your foot to your shin, yes. Okay, and let's try the other side. Good. Okay, now I'm going to have you just stand, close your eyes. We're going to do Romberg's test just to see if you have any drifting or anything. Nope, and you did awesome. And then last thing we're going to do, I'm going to have you take your finger, touch your nose, and then touch my finger. And continue. Touch your nose, my finger, your nose, my finger, your nose, my finger, your nose, my finger. Okay, good job. So now I'm going to test your gait. So I'm going to have you stand over there, walk to me heels to toe, heels to toe, heels to toe. Okay, good job. Good job. And then walk back, turn around, walk back on your tippy toes. Okay, and come back on your heels. Good job. Any pain, discomfort with that? All right, and you can have a seat back on the bed. All right, so how often are you going to the doctor? Are you going every year like you should to get annual checkups and blood work?
Yes.
Okay, that's good. That's very important that you stay on top of your health and get annual checkups as you should. And make sure every 3 years you're getting a women's exam unless you're for some rationale at high risk, okay? How's your lifestyle? Are you eating a lot of high fat foods, fast food, or are you cooking at home a lot? No. So that's very important. You should try to be active, working out at least 30 minutes, at least 3 times a week if possible. Also eating a lot of fruits and vegetables, drinking a lot of water because your body needs those things. And you definitely don't want to, if you can, control and avoid getting diabetes. Because I recall you said you had a family history of diabetes. So it's important that you start that. You're still young, so that's why it's good that you get this head start, okay? And then I know, did you say you got a flu shot?
No.
Okay, so we're going to try to get you a flu shot today if that's okay with you. And then otherwise, it's important that you just follow up with your primary care doctor at least every year. If anything, more frequently if you need to, like if you have a cold or anything like that, you're definitely more than welcome to follow up as well. But it's very important that you do those follow-ups, okay? And so your examination went well. I would like to thank you very much for allowing me to examine you. Okay? All right, and happy holidays to you. Thank you.